Hey everyone, I'm Kim.
I'm Terry.
And we are
Two Big Women on a Couch.
And we thank you for being here. We are together again and have an interesting topic that we'd like to just sort of talk about today. And that has to do with really people's rights to be able to have care, health care in particular. And so many people do without health care. And we want to talk about the challenges of that and what's kind of wrong with that picture. So, Terry, I think this is going to be a great topic. And
I do too.
We've got some strong passion around our beliefs. And again, these are just our opinions.
Right.
But let's go ahead and give it a roll, see what we think.
Well, I definitely think we need a socialized medical program in this country. I think it's good enough for our military folks. It's good enough for our old folks. It's really good enough for everybody. I think it's criminal, and not even criminal, but immoral, that you and I could go to the hospital. We could both be suffering from the same illness. And because you had a plastic card and I didn't, I could be left in a bed to die. Or better yet, put out on the street to die. And I just think that that's immoral. And I think for our country that builds itself on taking care of each other and on Christian beliefs and on the fact that we are a nation that's civilized people, I think we really fall short there.
I agree. I really think that for many years I've worked in social and health services, and as you know, have done a lot of stuff all the way to the top of that particular field. And so I've seen a lot. I've seen a lot of poverty. I've seen homelessness. I've seen people who just really can't get the kind of services that they need. And so I'm a strong believer in I guess capitalism. I think people really should work your asses off and get what you want to get ahead. I believe in that. But I also believe that there's some certain basic kinds of things that folks should not be without. For example, to me, it's so wrong for a child, and in this case, it was a very young black boy, African American boy, who had an abscess in his tooth. Not a big deal, right? You go to the dentist, you kind of get that all cleaned out and fixed up and what have you, right?
A little penicillin,
you're good to go, right? But that parent was unable to do that. Didn't have the insurance, didn't have the coverage to really get him that care. That abscess actually, the infection actually went to his brain, and the young boy died.
Yeah, and see, I believe that that's immoral.
That was tragic.
Yes.
That was tragic. A kid could have had his life saved had he been able to just get that abscess taken care of in his tooth.
And I think when you compare this country to other countries around the world, I'm not sure of the statistics, but I think we fall way short in terms of health care, and in terms of babies being born well and healthy, and just overall health care. And I really do think that it's time that we really understand that it's not where we want to be as a country, as a people that love and care for each other.
So what I don't get are people who just don't think that other people deserve or should have that kind of support. And I can tell you, I'm now in the middle of dealing with an issue, the cancer issue right now. I've never been sick in my life, never had other issues before. I'm very fortunate because I've got good insurance. I also actually have an Aflac policy. If folks don't know what Aflac is, I'm going to start quacking like a duck for real. It's been an amazing supplemental thing just for me to have stuff in my life. And I've got a good job, right? So I'm covered. I'm well. I'm going to be okay. I'm going to get through it. And I don't have to have those worries of having like major insurance. But I've got a very good friend whose insurance ran out. She paid the COBRA. She lost her job. She did everything she could, and was basically told, "I'm sorry," pretty much. She worked it out ultimately, but was basically told, "I'm sorry. You don't have insurance. We can't treat you."
Or then you have the others who are in a situation where I am, where I work full time, overtime, more than 50 hours a week typically. Really need to have some work done, but it's not the fact that I don't have the health care to cover it, it's I can't afford to be off work, because missing work would put me in a position not to pay my bills. And I think that people that are in those kind of health care situations need the support. They really do. And we're not all have the foresight, for one, or the ability to make payments into some of the insurance programs. They're just too cost prohibitive for people. And in my case, it won't cover pre-existing conditions.
Well, and that's the other thing. As you get older, there are certainly more pre-existing conditions to kind of deal with and so forth. So, yeah, I guess the whole point of this conversation is, I'd really like for people to chime in and help us understand why there are people, and if you're one of those people, we're not putting you down, and we still love you, love everybody, but, you know, why would it not be okay? Because I don't get it. Why would it not be okay for folks to be able to have the support that they need when they're ill? Why is it not okay? Because there are a lot of people who believe that I got mine, I'm good. You don't need yours. I might have to lose something if I let you.
You may get into the doctor before I do, and I don't understand that either, Kim. And I'd really like to hear their opinions as well. But I also think it would be nice to hear some support, and maybe we could even do something in terms of really trying to push this forward, where we could, you know, in a way that would be positive, to at least be a sounding board for folks that don't have it and need it, and at least offer the support with our words and love and concern.
And ideas of resources. We do have ways of helping people to get sort of what they might need, or at least get in the right direction to figure out how they might do what they need. Absolutely. Yeah. Yeah, so the two things, I guess, that we're looking at are, one, people chime in and help us to figure out what we can do to show, basically, our folks in our country that it's important, number one. And secondly, then, for those who need support, I guess they can reach in to us and to you and find resources and so forth that can help them get through.
And by all means, if any of you have resources, share them.
Absolutely.
Share them. Share ideas that you might have, ways to get health care at a minimal cost. Do you know how to get pharmaceuticals at no cost or at a minimal cost? And if you know those resources, we'd be happy to post them and put them out there for folks.
Or you just come on and post them at Two Big Women on a Couch.com. And go ahead and either join or log in and post your blogs. We reserve all those blogs, and we can put those back out on our newsletters and things of that nature. But we really want to be proactive. We want to be able to help and make a difference for those who are less fortunate, because you really never know. One never knows when they're going to need something like that. Like, I never thought I would have cancer.
Right.
Never thought in a million years. I pre-planned for some stuff just in case, but never thought, you know. So thank you so much for listening to us. We really appreciate your support, your friendship, and your membership as well. Two Big Women on a Couch.com. I'm Kim.
I'm Terry.
And we are
Two Big Women on a Couch.
Thank you.
Thank you.